pediatric abdominal wall defects. It includes umbilical hernia, omphalocele, and gastrodysis. Umbilical hernia. It is the defect in the linea alba and it is covered by skin, and it may contain the bowel, and the umbilical cord is inserted towards the apex. And omphalocele, it is in the midline abdomen wall defect and it is covered by the peritoneum, and it contains multiple abdominal organs, and the umbilical cord is present in the apex of the defect. Gastroenterocele, it is the defect in the right of the cord insertion and it is not covered by skin or membrane, and it contains the bowel, and umbilical cord is inserted next to the defect.